welcome back to another episode of Recharging the Human Battery. I'm your host, Dr. Stefano Sinicropi. We are on AM 950 radio, and we've got a good one for you today, something that is one of my biggest passions outside of spine surgery itself, and that is concussion. Now, last week we talked about the problem of whiplash injuries, neck injuries, how to treat those, how to seek help. Concussion is a massive problem in our country and other countries. Obviously, we're going to focus on the United States. It affects about 1.5 million Americans every year, and about 3/4 of those are mild. Now, our group covers a level 1 trauma center, so we see the more severe injuries where people have subdurals or what we call bleeds next to the brain and things like that. Those are what we consider more severe, and the vast majority of those patients obviously have concussion and are going to have a lot of issues. Some of them spend a lot of time in the ICU. Some need emergency brain coiling or brain surgery. But we're talking about the bread and butter concussions that happen every single day. Everyone is aware of the massive amount of concussion in sports. It is something that has been, popularized dramatically. That the movie with Will Smith, Concussion, which showed what can happen with constant concussion after concussion and developing something called CTE, has been very popularized. So concussion is something we are talking about a lot more. But I will tell you that as a practicing spine surgeon that sees tons of people that have been involved in motor vehicle accidents and some athletes that I'll see with residual concussion, but I can tell you I see so many people who have either had falls or have had motor vehicle accidents or other types of injuries. They're actually coming to see me for their spine-related conditions, but they actually still have concussion symptoms. We call that post-concussion syndrome. We'll talk a little bit more about that, or a lot more about it, actually on the other side of the break. But it's a massive problem. It can really devastate people's life. It can devastate their ability to work, to be functional members of society. It's very difficult when you can't even read a single page on a book without developing a headache or feeling the room spinning or being not able to be in the light and needing to wear glasses all the time, or just having a constant head pounding, or just not feeling yourself, trying to find your words, and all kinds of other things, including insomnia, restlessness, just explosive kind of behavior where your mood is labile. There's so many things that are associated with concussion. Now, this might be shocking, but there's probably over 300,000 just sports related concussions that show up. And as we talked about before, in sports, a lot of concussions are not even picked up because either, people don't realize it, or it's kind of put to the side because people don't want to miss time. And it is a big problem. That's just in the sports-related concussions. When it comes to motor vehicle, there are numbers out there, but it's probably not even accurate because, again, a lot of these things are mixed with other injuries that people have and things, or people just don't know it because it's a more minor injury, but they do have concussion symptoms. And so the economic impact, it's huge. It's in the billions. It's pushing 20 billion. Again, very difficult to exactly pinpoint how bad it is, but I can tell you with the patients that I see, many times it's taken a very significant economic tolls in their lives. And so it is something that I'm very passionate about. I'm actually currently doing an entire other training program in concussion to become officially certified in concussion management through a functional medicine approach. I'm very excited about that. I've been doing that for a while, and that's going to finish up here this year. And excited to talk to you today about what we can do about it. So on the other side of the break, we'll really get down into the weeds on concussion and what you can do to help yourselves and your families come out of that dark hole. We'll see you on the other side. We're on AM 950 radio. This is Recharging the Human Battery. side of the break here. This is AM 950 Radio, Recharging the Human Battery. I'm your host, Dr. Stefano Sinicropi, and we are talking concussion today. So I think before we really get into my thoughts, and again, not medical advice, I always make that very clear. You need to talk to your own providers about how to manage your concussion. But before we really get down into the discussion of how to treat concussion, we have to talk about what happens in concussion. Now, first of all, concussion is an ill-defined thing. Now, there are multiple different societies that come out with definitions of concussion. So it is not clear, but there is no exact agreement in what defines concussion. We know that it is an injury to the brain. It can cause all these different symptoms. I mentioned some of them before: fogginess, brain dysfunction, slow executive function, things like that. But as far as defining concussion itself, it really is something that is a brain dysfunction. So we'll just use that for now as the definition. So what happens in concussion? So there's either a direct blow to the head, and there's certain types of blows that make it more likely to be concussed. It can be a rapid whipping back and forth and acceleration of the head, such as that happens, for example, in a whiplash injury where you have a seatbelt across your chest and there's a sudden stopping force, or you're hit and suddenly your head whips forward and back or side to side or some combination of that, and the brain is basically, call it coup and contre coup. So basically it goes from one side to the other, hits the skull, and then snaps back the other way, and that can cause a brain injury. So what happens? Okay, so again, we know about the bigger brain injuries. You can imagine if you have something severe and you tear vessels in your head, you're going to have a bleed. And again, we're not really talking about that. We're just talking about the bread and butter concussions that happen in sort of everyday life, and especially the ones that are missed. And so there is a cascade. So just imagine, okay, a brain cell. There's a bunch of brain cells in there, and all of a sudden there's this tremendous force that's coming across it. So imagine that brain cell. So the brain has a head, okay, of the neuron, and then there's an axon, and that's the tail. There's other types of neurons that are different. But let's just say this thing really stretches and stretches and stretches, right? And then snaps back. What happens during that shear? During that shear, there is a disruption in the membrane of those nerve cells. And what are on those membranes? There are these channels. Okay, I'm not going to get too deep in the weeds, because you'd really need to know very deep physiology and brain chemistry. But there are these channels, and those channels allow ions such as calcium and sodium and and potassium to come in and out of those cells. That's how the walls of the cells work. Same thing with the mitochondria, which are inside the cells. Same thing happens to them. And so as they shear, you have an injury to those channels. We'll call them ion channels. And all of a sudden, what happens? They're not working right. So things can pour in that are not supposed to be pouring in. And one of the big ones is calcium. And so you can have a significant injury to the neurons from this inflow of these ions. And it creates an injury. Now imagine there's a disruption, and it lasts for a while. So the more this goes on, the more disrupted it is, the more these ion shifts can happen. And when that happens, the same thing is happening in mitochondria. We call it an energy crisis, because we use this cellular dance, this symphony that happens inside the cells is how the brain cells produce power, how they work. Okay, if that is disrupted, then what happens is that they can't produce the gasoline of the cell, and that's ATP, and so the cells don't work right. Okay, so the same thing is happening in the mitochondria. That's what's producing the cells, and it creates an inflammation and what we call a diffuse axonal injury. So those axons, which are the way that the nerves connect with each other through the axons, and then there's something called the synapse. Those can be disrupted, and you have all kinds of dysfunctions. Again, not getting into the weeds, it's actually pretty fascinating. So for those of you that are, they're interested, please, write to me. We can have discussions on this. Very, very fascinating, and things are really being discovered all the time on this. The bottom line is there's the initial acute injury that happens, and then there is an entire cascade of events that happens and keeps happening. So there's the early cascade that happens pretty immediate, in the immediate aftermath, and then there's a constant cascade of inflammation that happens. And that's where I think the biggest potential for targeting is going to occur, and we'll get into this in a little bit. So, okay, this happens. You get the shearing stuff. You get all this stuff happens. You're dazed and confused. So, again, going back to the definition of concussion, loss of consciousness, by definition, is a very strong indicator of concussion. But many concussions don't have loss of consciousness, but people still have significant symptoms afterwards. So there's a way to grade concussions based on how much loss of consciousness you have and how much symptoms that you have. So what are some of the common symptoms, whether you lose consciousness for a bit or you don't, right? So people report headaches, dizziness, nausea, a lot of confusion, a good word, things that people describe to me. The most common thing is a brain fog, difficulty remembering things, especially in that immediate pre-concussion period. Many times we ask people what happened and they can't remember. That's indicative of a somewhat more severe concussion. Irritability, it is a big one. People that have concussions will talk about how irritable they are, how anything will set them off. Why? Because their brain is not working. It's almost as if they have some sort of a psychiatric disorder. And again, right, psychiatric disorders play into the way brain functions, and that's why the fields of neurology and psychiatry, although they're separate, there's a huge overlap between the two because each is affected by each other. So even the name of the game here is that even mild impacts can create concussion, and it's really difficult to know which impact is going to cause what. Obviously, the more severe the impact, the more likely the severity of the concussion is going to be. But again, even mild impacts, no, and it is not yet defined why exactly some people recover perfectly after 7, 8, 9 days, sometimes even sooner, and other people go on to develop something called post-concussion syndrome, which festers and festers and festers, even from minor hits, and sometimes they don't even know. And if we as providers are not asking the right questions, investigating them, doing surveys such as the Rivermead concussion survey, one that I use, it's going to be difficult sometimes to pick up these subtle things, but we have to pick up like things like people say, I just really feel foggy, like the light bothers me, little, subtle signs. But it's very interesting that I see myself, again, they're not even coming to me for concussion. They are when they're seeing me at the integrative health clinic, but they're not when they're seeing me in the spine clinic. How many concussions we've picked up? I want to say almost every clinic, I'll pick up a concussion, sometimes two, sometimes I won't, but it is very, very common. So what's the standard? So now we have to talk about, actually one thing I should mention is one thing that puts us at more risk, and that's not, this is the point of this radio show is more to tell you what might be available that you're not aware of rather than to get into it, but the second impact syndrome. One of the reasons that we don't allow sport athletes or anybody to get back to an area where they have another concussion is the very well-known phenomenon of second impact syndrome. Second impact syndrome is very serious. That's why we don't want our players to get back on the field until they're totally cleared. A second impact, if you're still concussed, you're much more likely to have another concussion and a higher level of concussion. Not to mention, if you are concussed, your balance, your coordination is not normal, and so you're much more likely to have other injuries because you're distracted by the fact that you have a brain fog and you're not thinking, and your reaction time is going to be clearly slower. And so these are really important. So I just wanted to bring that up before we get on to what the traditional treatments are for concussion. What is standard care for concussion? And this is what people do. The best care is going to be a multidisciplinary approach. However, the thing that is absolutely done the most, okay, and again, there may not be a specific giant study I can point to, but I know I talk to people all the time, is still this passive approach, this rest. Go home, go in a dark room, don't do anything, don't do exercise, don't do anything, right, is really it. Wear blue light glasses, stay away from the light, things like that. There is clearly evidence that is showing that a prolonged passive approach, although if you want, rest for a day, a prolonged passive approach to concussion management can absolutely increase the risk of developing a post-concussion syndrome. So it's very important to make sure that you see providers that are very adept in treating concussion and understand the importance of gradually progressing the activities under medical guidance, but just not, quote unquote, waiting it out. Because again, I just want to stress, people that get into that post-concussion issue, it is very difficult to really bring them back. And sometimes they just get lost in these non-helpful treatments, whether medical or they're looking outside of the medical system, and that can be very detrimental to their recovery. So there's a lot of good, concussion, recovery programs across the country. It is something that I spend a lot of time studying because we are really focusing in our integrative health clinics at developing concussion strategies that are active. And so I want to focus today on things that are outside of what is traditionally going to be offered in the usual circles. Now, so there's all kinds of stuff. There's vestibular. So vestibular is really looking at improving balance and things like that. So there's vestibular therapies. There's basically ophthalmology type therapies that we do, prism glasses and other things. These are done fairly routinely in many concussion centers, and they can have really good benefits. But there is so much more out there that is being developed that I think is very important for people to be asking questions about and to think about adding them into their regimen for treating concussions. So what do we need to do? Like, what are we trying to do? When we say we want to do an active recovery program, one of the things that happens in concussion, okay, is you have a dysfunction of the nerves. Some nerve cells can even die, or they can stop functioning well. But the connections between the nerve cells are disrupted. So whether that's a chemical disruption or a physical disruption, it doesn't matter. They're disrupted. So those brain cells are not talking well to each other, which is why people are feeling dazed and confused. They're slower. Their reaction times are slower. They're having all of these symptoms related to concussion. So how can we actively target that? This is something that I'm spending so much of time with our clinical team really working on ways on targeting that, okay? So there is something called brain-derived neurotrophic factor. This is in the neurotrophin family. Again, not to get into it, it is a substance that is very important in creating recovery of the nerve cells and improving what's called synaptogenesis, or reconnecting those nerve cells and even regrowing of the nerve cells. So they promote nerve survival, growth, and synaptic plasticity. What is plasticity? That's the ability of the brain to heal and to change. Okay, just doing, like, for example, if you learn the piano, you're utilizing plasticity. The brain is changing. So when the brain is injured, we want to take advantage of anything that we can do to increase brain-derived neurotrophic factor to help to stimulate brain repair and synaptogenesis, or reconnecting of the nerve cells together. Again, I don't want to go deep into the weeds because that's beyond the scope of what we're talking about right now. So what are the strategies that we have really focused on in our integrative health clinics to bring forward, and things I focused on my podcast and other shows that I've done and things like that? One of the most exciting avenues to really target concussion and target it early and create potentially reversal of symptoms, but also works in the post-concussion period, is something called transcranial light therapy, which I could not be more excited about. Transcranial light therapy is essentially shining a light on the brain. And so you can do it with LED lights or you can do it with laser therapy. Laser is going to penetrate the skull better, but even LED treatment, as shown in the Harvard study, actually penetrated the skull by about 3%. And we know by studies, actually one was just published, that the density of mitochondria, again, that's what's going to produce the power in your brain and really function, get things going. It's the gasoline. It's producing gasoline, the ATP. They are more numerous in the gray matter. Okay, so that's the cortex. That's the outside of the brain. So that's really where we can reach with light therapy. What does the light therapy do when it reaches across? Well, it is absorbed in mitochondria. I've talked about this ad nauseum. For those of you that follow me, I say the word mitochondria over and over. Why? Because it's one of the most important things we should be talking about, because targeting mitochondrial dysfunction, not just in concussion, but also in Alzheimer's disease and all types of brain conditions, including a lot of psychiatric conditions where the big ones are depression and anxiety and PTSD, targeting mitochondrial dysfunction is a huge part of future targeting of how we are going to really address these conditions and do a better job of helping people to recover. So when we shine the light on the brain, we're improving mitochondrial function, which absolutely then sends signals to the cells to heal better and to do things. Now, this is not something that we're just wishing for. I'm just casually saying, oh yeah, it improves mitochondria. No, this has been borne out by the studies. The studies are very clear. When you shine the light on the brain, you're increasing brain-derived neurotrophic factor. This has been studied. It has been studied both in the animal models and in humans, and there's clearly increase in that. Now, when I had Dr. Michael Hamlin, the absolute guru of transcranial light therapy, okay, he is the one that wrote the book Photobiomodulation in the Brain. It is the Bible of this stuff. When I had him on my podcast, we talked about synaptogenesis, and that is creating new brain cell connections. And he made it very simple. You shine the light on the brain and you're creating synaptogenesis. This is something that should excite people, because if we can repair brain cells, if we can repair those connections by shining a light on the brain, it is a tremendous opportunity to do so many things. Okay, so let's talk about this for a second. You have a concussion. You have those injuries we talked about. Your brain cells aren't working right. The ions are going in the wrong place. You're having all this inflammation. All this stuff is happening. When you shine a light on the brain, you're doing many things. You're increasing blood flow, so the right cells, the right repair things, and signaling molecules can get to the area. You're improving the function of the mitochondria. You are increasing brain-derived neurotrophic factor, which is absolutely necessary in repairing the injured brain. And you're targeting something called the glymphatic system, which is the lymphatic system of the brain. And you're doing all of these things are associated with dysfunction and concussion and other diseases of the brain. And so think about how much it makes sense to target it early on. And so these are things that are getting studied more and more. The data doctor who is studying the PET scans, SPECT scans, okay, which show areas of function in the brain. His name is Dr. Theodore Henderson. He's a psychiatrist, well-known psychiatrist, and we actually wrote a white paper together showing that talking about transcranial laser therapy. But what it clearly shows, and he presented a lot of his work at a recent meeting that we were at, what it shows is that people that have a concussed brain, when you treat them with light therapy to the head, you're seeing dramatic improvements in the areas of the brain that are not functioning on their SPECT scans. So you're also seeing increase in blood flow on their functional MRIs. So again, if we shine a light on the brain, we're improving the way the brain cells function. We're increasing brain-derived neurotrophic factor, and this is probably the first time you heard it here, right here, brain-derived neurotrophic factor. Tell all your friends, right? You're improving the function on actual scans of the brain. And here's the kicker. In studies, it shows that if you shine a light on the brain, the executive functions, in other words, our reaction time, the way we process information, all these other things improve by shining a light on the brain. Again, well documented and well studied. Why is this not a modality that we want to put on the brain immediately with concussion? This is something we have been doing in our clinics. Again, not medical advice. Please feel free to contact us if you want to come in and learn more about it, or you just have questions. Please find me on social or underneath the radio show here. But this is something that we have been doing for quite some time in our clinics, and clearly showing that patients are having significant improvements in their brain function, and they are getting better. Again, they are doing this in conjunction with whatever other treatments that they're doing, and I agree with so many of the treatments that are out here in concussion, but this active management by putting light on the brain has so much potential to make a dramatic impact. So for those of you listening to this, if you or your loved ones have been impacted by a concussion or still having symptoms or have questions, please ask about the possibility of treating the brain with light therapy to your providers, or if they're not aware of it, find somebody who knows about it, because the research is becoming stronger and stronger. And again, I'm working with the guys at Harvard, Dr. Paolo Cassano, and talking to other people across the country. It is being used more and more, both in the neurology setting and in the psychiatry setting, to make significant impacts on so many conditions. But again, here we're talking about concussion, so it's very important. So let's move on to the next thing. Again, what are we trying to target? We know that if we improve brain-derived neurotrophic factor, throughout the body. And there's other ways that you can do this. Exercise improves it, and oxygen may improve it, and other things. But again, I'm talking about things that can really stimulate a powerful response of brain-derived neurotrophic factor. So something else that we have brought into our clinics is very, very interesting, is something called the Neuro 20 suit. And we're one of the only, clinics that are doing this in the post-concussion period, and it makes a lot of sense for many reasons. So what is a Neuro 20 suit? It's a whole body suit that you wear that you create electrical muscle stimulation across the entire body, and there's all these settings, so you can stimulate the different intensities, different frequencies, but different parts of the body, necessary. Now, there are studies now that are showing that brain-derived neurotrophic factor increases with certain types of whole-body electrical muscle stimulation. Again, what is this doing? It's improving neuroplasticity, which may improve concussion recovery. Now, this was absolutely rolled out, and there are many studies now going on with the NeuroSuit at world-renowned institutions for use in recovery in general. So we use it for things like spasticity, and using it for recovery from other injury or people that are post-stroke, things like that. But utilizing it in a concussion setting, again, the downside is negligible, but the upside is you're increasing brain-derived neurotrophic factor, and now the studies are ongoing looking at the areas of the brain that are being affected. So imagine focusing on those same areas, whether you're using light therapy or using things like whole body electrical stimulation. These are things that we need to be focusing on, but more importantly, what are we doing? It's a form of physical therapy, and we know physical therapy it's always been a part of concussion recovery, but now we're taking it to the next level, and we're combining it and exploring it in the use for brain health. Again, so many benefits to the use of something like the Neuro 20 suit, But if you can get that added benefit of increasing brain-derived neurotrophic factor, clearly there is going to be a synergy there, and this is something that we are now studying and very excited about what is being seen here in treating patients. Now, two other things that I really want to touch on briefly. Oxygen therapy. You guys know about hyperbaric oxygen therapy that has been looked at in the literature, and there are clinics across the country that are using hyperbaric oxygen therapy because, again, it can potentially increase brain-derived neurotrophic factor, increase oxygenation to the brain, and a whole host of other benefits of oxygenation that I've talked about ad nauseum before. We utilize in our clinics also exercise while under oxygen therapy. We have to start it a little bit down the road because people can only exercise to a certain degree after they have a concussion. That needs a lot more studying, but again, we're hyperoxygenating people. We know that there's major benefits, so that is part of our concussion recovery protocol. And very excited that we are now adding into especially our post-concussion syndrome management, something called transcranial magnetic stimulation. So that's basically you're targeting with magnetic stimulation specific areas of the brain. Now, where is this FDA approved? I mean, it's FDA utilized for things like specifically depression that's resistant to medications, but certain types of PTSDs and other things. Well, guess what? Those things actually come about as part of the concussion picture. And there's a big blend. Remember I said neurology and psychiatry. There's a blend. And it really is a fascinating, topic. Again, it's FDA approved specifically for depression, but TMS, or transcranial magnetic stimulation, and again, I talked to a lot of people across the country on that subject before we even brought it in. This is newer for our clinic. Is something that has been used widely for anxiety and depression and eating disorders and PTSD, and other things. Now, what we're excited about is that if we can treat that portion of concussion, which is that that deep depression that sometimes develops, or the anxiety that's not really improving with medications that psychiatry is putting people on, or so on. But what we have brought in is a device called the ExoMind device, which is a very new device. But what it does is, instead of having to do transcranial magnetic stimulation pretty much every day during the week, or at least 5 or 6 times, and doing a very extended period, the ExoMind device allows treatment just 2 times a week for 30-minute sessions. So it's much more convenient. But the big thing, again, as a provider, the big thing is, when people have to do something every single day, a lot of people will give up and they'll quit. It's a lot easier to do something 2 times a week for 30 minutes. So we believe that we're going to see people absolutely finish the entire program because it's a lot easier to do in a short time frame and only 2 times a week. But the bottom line is that utilizing transcranial magnetic stimulation for those types of symptoms which are related and are seen quite often in the post-concussion syndrome, utilizing it, I think, is going to make a significant difference for those particular types of extra symptoms that people have. Now, before we close up, so looking at all of these modalities, very interesting, where people that have undergone going back to the light therapy and things like that, when we look at, for example, Dr. Henderson's work that he talks about very often in meetings and things like that, again, it's not just showing it on SPECT scans. If you look at reduction in irritability, insomnia, headache, brain fog, all these other things, the decrease in those things is dramatic utilizing light therapy. And it is dramatic in that post-concussion, period. It's also dramatic for people that have PTSD and other things. And so again, this isn't just something that we're wishing is helpful. This is something that is showing more and more promise. And clinically, looking at how patients are doing, they're doing much better with these treatments. Again, not medical advice, but the thing is that I want to emphasize, and I say it so many times, think about what I'm talking to you about. light therapy on the brain, stimulating the body with electromagnetic stimulation, oxygen therapy, right? These are things that the risks of doing them are tiny compared to trying to do medication management or big procedures. But unfortunately, because the risks are low and because they're much lower cost than big guns, medications, and things like that, funding for them has been very slow to come about. And we need a lot more funding to be able to really push the bigger research studies that need to be done so that this becomes something that is absolutely immediate care. In my opinion, and again, I want to stress, in my opinion, seeing what I've seen now treating patients for a couple years with these modalities, I will tell you that it is absolutely should be the standard of care because the downside is so extremely, it's almost negligible. In fact, if you look at some of the official position statements of photobiomodulation, clinically insignificant risk. Clinically insignificant risk. That's right from the FDA. So again, I just want to emphasize these are safe things. These are things that you really need to be asking about. So as we get kind of close to the end here and start wrapping up, post-concussion syndrome is something that I mentioned over and over again as I see it all the time. 10 to 30% of people are still having symptoms after concussion. And a lot of them are told, oh, you're recovered, you're fine. 3 months after. That's a big percentage. If you start looking at numbers like 30%, that's like a huge number. There's these consortiums that are out there. There's all these things. There's things that clearly show that there's a lot of people out here festering, and you might be one of them. Your family members might be one of them. It's a big problem. What I really want you to do is I don't want you to give up on it. I don't want you to take no for an answer. There are things that we can do to improve the quality of life in post-concussion syndrome. There are so many of people that are coming to see us now for concussion that are literally, verbatim, have been told, well, there's nothing to do. Sometimes they get better, sometimes they don't. I'm really sorry. Things suck. What are you going to do? First of all, not acceptable. Absolutely not acceptable. But there's other people that really have not really seen any hope. And again, we're not making claims, we're not saying anything, but trying these very conservative modalities, which again are having more and more research behind them on a daily basis, there really isn't much of a downside. You've got to keep exploring because hope is what keeps us going. Hope is very healing, and you have to look for things that provide hope. And again, I am just trying to really study, research these things, talk to people from all over the country and the world, and try to put together options for people to get care for something like a post-concussion syndrome. So my plea to you is please don't give up. I know how much it can disrupt your lives, but there are answers out there potentially for you. Not everybody, but many people can have dramatic improvements in their symptoms, and it can make a huge impact in their quality of life. Again, the studies, they support at least trying the things. It's safe. We see changes on things like SPECT scans and MRI scans. And so I am just a person that hates to see suffering and people giving up and just thinking there's nothing else you can do. So again, talk to your providers. Ask about these things. Ask us. I'm wide open. Love answering your questions. Come in and see us. Go in and see your providers if you're listening to this, somewhere else or you're learning about it. Find people that are looking outside the box because a lot of the traditional care that we've done for concussion, frankly, is just not enough. And you're missing the opportunity to have so many different things provided that can potentially be of significant benefit, to you. I kind of get emotional about this stuff because I see it all the time. I really just want to help people with their brain health, and we're going to talk about things like early dementia and others in further shows. So on the other side of the break, we'll wrap this up. I want to tell you about some of the upcoming things that I'm going to be doing to try to promote light therapies and some of the other things that we are doing in concussion. We're on AM 950 radio. This is Recharging the Human Battery. I'm Dr. Sinicropi, and we'll see you on the other side of the break. Okay, we're back on Recharging the Human Battery. I'm Dr. Stefano Sinicropi. We're on AM 950 radio. And, I hope that you have been able to really get some interesting information on concussion and really what's out there. And I am making it an absolute huge part of what I'm going to be doing over the next couple of years to be out here promoting the advances that have been made in things like light therapy and electromagnetic stimulation and transcranial magnetic stimulation and other things in giving people that have concussion and post-concussion syndrome hope. So I'm not just sitting here on a radio show and just going to talk about it and then not do anything about it. Obviously, I'm going to actively promote it through all the channels that I'm doing. But what I'm most excited about, so I will be going down in early May to Washington, D.C., along with the Society for Brain Mapping. We call it Brain Mapping Day. My part of the lobbying, we do lobbying for a lot of modalities and treatments, is going to be really talking about light therapy to the brain, what it shows, and why it is so important to have this as a big part of the way that we treat brain injuries immediately, and then for people that unfortunately go down that path and have long-term problems like in post-concussion syndrome, not to mention in dementias and psychiatric conditions as we've mentioned before. Upcoming later in the month of April, I'm actually giving a TEDx talk at Harvard Square, and I'm specifically going to be focusing on the utilization of light therapies throughout medical treatments and the promise of light therapy to make a massive impact in the world on so many different conditions. There's thousands and thousands of articles on light therapy, but one of the parts of that TED Talk is going to be talking about patient experience, but also what light therapy can offer to people that have things like concussion or dementia or others. But how do I end that TED Talk? I end that TED Talk by a call to action, because it's not enough for us to talk about these things. If I just sit in a room with my colleagues and go on and on about, oh, this is great, or just treat a small segment of patients that decide they want to come to me to look at some concussion options, I don't think that I'm doing what the best that I can do. So I really want to be out here pounding the pavement and calling for action, because anything that we do, no matter how amazing it is or whatever the scientific research discovered, if people don't know about it, they're not going to seek care. If the medical community is not really aware of it or doesn't believe in it or hasn't studied it, they're not going to offer it to their patients. And that's why people are not being offered these things. And I could not be more, passionate, about it. So I'm very excited to stand in front of Congress, not all of, the congressional delegations that we'll be talking to, and giving it my absolute best in really trying to promote this technology. Same thing when I stand on that stage at Harvard and talk about it. Same thing when I do the grand rounds at Harvard, coming up late in May, when I talk about these things. So I could not be more passionate about it. I'm going to continue pounding the table. Why? Because it's safe. I believe in it. The studies support these things that we're talking about, and people are hurting. They need help. You and your families need help when this happens to you, and just sitting there, listening to, well, unfortunately, there's no treatment for this. There's nothing we can do. You're out of luck, is not acceptable. And I'm not going to accept it. I'm not going to accept it for you. I'm not going to accept it for your families. I'm not going to accept it for the medical community. I'm not going to accept it for the world. We need to promote these technologies. It could not be more important. I hope you enjoyed my rant today. And I'm really trying to keep my calm here when I kind of go down this avenue. So We'll see you next week. This is Recharging the Human Battery. I'm Dr. Stefano Sinicropi. We're on AM 950 radio, and it has been an absolute pleasure talking to you about concussion. And remember, if you're suffering from concussion or post-concussion syndrome, seek the right care. It may mean the difference between recovering and festering and having a massive impact negatively on your quality of life. See you guys next week.